everyone, welcome to a special video on the most amazing and vital organ of the human body, that is heart. Especially on the theme of this year World Heart Day, which was observed on 29th September. No heart, use heart. Okay, from nurses, the heart of healthcare. Keep learning, keep growing. My name is Shanaz, and in this video let's all of us participate in this quiz and test ourselves how much we know about our heart. Okay, so that is the main intention. Let's test ourselves how much we know about our heart. So there are totally 30 questions. Okay, if you get the right answer, please give 1 point to yourself. And this quiz is both for medicos as well as non-medicals. Okay, just test yourself. Okay, so as we all know that the theme of this year World Heart Day was No Heart, Use Heart, which is a global call to remind everyone to take care of their own heart, as one can only love and protect what they know and what they are aware of. See, heart is central to life, and a healthy heart is key to healthy life. Okay, so if you neglect your heart, you are neglecting your life. So if you want to live a happy life, a healthy life, then you should take care of your heart and do participate in this simple, easy and interesting quiz related to heart. Okay, and the name of this quiz is Test Yourself How Much You Know About Your Heart. Okay, so total 30 questions. Let's get started. All of you are ready? If you get the right answer, please give 1 point to yourself, and at the end check how much total you are getting. Okay, chalo, let's get started. Ready? The first question is where the heart is located in the human body. Okay, what is the location of the heart in the human body? Come on guys, answer. See, if non-medicos, if they say that it lies in the chest cavity or in the thoracic cavity, it's fine. But medicos, I mean those from the medical professional, you are expected to tell it in medical terminology. Yes, so the exact location of the heart in the thoracic cavity is the mediastinum. Yes, this compartment, it is called mediastinum. Okay, so the heart is located between the two lungs. Okay, these are our two lungs. The heart is located between the two lungs. Okay, in the middle of the chest, behind and slightly towards the left of the sternum or the breastbone, above the diaphragm. This is diaphragm, the respiratory muscle. Yes, so above the diaphragm, in between the chest. Okay, in between the chest and what we say, slightly towards the left of the sternum. But there is a special condition called dextrocardia. Okay, dextrocardia, it is a rare congenital heart condition in which the heart is in the right side of the chest. Okay, not completely in the right side. See, even in the normal condition, the heart is not completely on the left, it is towards the left, as you can see here. But in dextrocardia, as you can see here, the apex of the heart is pointed towards the right side. Okay, it's a rare congenital disorder. Okay, so here the apex of the heart, it is towards the right, whereas in the normal condition the apex of the heart is towards the left. Okay, so this also we must be aware of, dextrocardia. Okay, so this is the location of the heart exactly. So if you have given the right answer, please give 1 point to yourself. The next question is, what is the shape of the human heart? Come on guys, answer. What is the shape of the human heart? It is cone shaped. Simple. Okay, heart is cone shaped organ. It is like inverted cone. Yeah, like upside down pear. Yes, it is inverted cone. See this the pointed portion of the heart is called the apex, and the broad portion of the heart, which is on the upper side, it is called the base. Okay, so it is a conical shaped organ. Fine, that is the right answer. If you have given the right answer, please give 1 point to yourself. The next question is, what is the size of the human heart? Okay, what is the size of the human heart? The answer is about a clenched fist or about a closed fist. Okay, or slightly bigger than that. So the size of the heart is equal to the size of your closed fist. Okay, as you can see here, as we grow, our heart size also grows, but up to certain age. Fine. Okay, so the size of the heart is approximately about the size of our closed fist. Fine. If you have given the right answer, please give 1 point to yourself. The next question is, what is the weight of the human heart? Okay. What is the weight of the human heart? The human heart, it weighs about 7 to 15 ounces. Okay, the answer is 200 to 425 grams approximately. Okay, 200 to 425 grams is the weight of the human heart. See, the human heart, it is made up of muscle. Okay, it's a muscular organ. Okay, as you can see here, it's a muscular organ and it looks red like meat. Okay, it does not have any bones. Okay, so it is a muscular organ with lots of blood supplied to it. So that's the reason it looks red like a meat. Fine. Okay, so if you have given the right answer, guys, please give 1 point to yourself. The next question is, which bone covers and protects the anterior side of the heart? Okay, it is the sternum. The answer is sternum or the breastbone. This bone, as you can see, it covers the anterior side of the heart. Okay, heart is actually protected by the rib cage or the thoracic cage, okay, which is made up of the sternum, the ribs and the thoracic spine at the back. Okay, all this together protects the heart. But if they ask in the question specifically anterior part, then it is by the breastbone. This one, the breastbone or the sternum. Fine. If you have given the right answer, guys, please give 1 point to yourself. Then the next question is, name the compartment or the space between the lungs that contains the heart. Simple. This the answer of this we already discussed in the first question. Okay, the compartment or the space in which the heart lies is called the mediastinum. This part. Okay, it is called the mediastinum, above the diaphragm, between the two lungs. Okay, this compartment where the heart lies is called mediastinum. Okay, so that is the right answer. The next question is, the bottom portion of the heart is anchored to which organ? Okay, see, this is the bottom portion of the heart. Okay, and it is anchored to the respiratory muscle called the diaphragm. Okay, so the answer is the diaphragm, this one. Okay, so the lower portion of the heart is anchored to diaphragm. Diaphragm is the right answer. So we finished with 7 questions. The next question is, how many chambers are there in a human heart? How many chambers are there in a human heart? So the answer is 4 chambers. Okay, so the heart contains 4 chambers. 2 chambers at the top, which are called the atria. Here we have right atrium and the left atrium. Then the lower chambers are called the ventricles. We have right ventricle and the left ventricle. Okay, so altogether 4 chambers in the human heart. The next question is, what is heart protected by? Okay, what are the structures that protect the heart? Okay, if you see all together, in one word you can say the heart is protected by a bony structure called the rib cage. Okay, rib cage, or the other word is thoracic cage. Okay, so this is called the thoracic cage or the rib cage, which is made up of sternum in the anterior part, the ribs on either side, and at the back side you have the thoracic spine. Okay, so all these bones together, they form a rib cage or thoracic cage inside which the lungs and the heart is protected. Okay, so this protects the heart from external injury. Fine. So this is the protection system of the heart, that is rib cage or the thoracic cage. If they ask you specifically what it is made up of altogether, then you can say sternum in the front, which is also known as the breastbone, then the ribs on either side. Okay, so we have 12 pairs of ribs, altogether 24, yeah, and the thoracic spine at the back. Okay, so these are the structures that protect the heart. Then the next question is, what lubricates and protects the heart from sudden shock or damage? Okay, what lubricates or protects the heart from sudden shock or damage? The answer is, come on guys, tell me. The answer is pericardium. Okay, peri means around and cardium means it is related to the heart. So around the heart. So around the heart there is a thin sac, okay, which surrounds the heart, and it keeps the heart fixed in place in the chest cavity. It also protects the heart from the infection. There are many functions, but the main function is it lubricates and protects the heart from sudden shock or damage. Okay, this is the pericardium membrane, okay, which protects the heart, which covers the heart and which protects the heart from external shock. Fine. So pericardium is the right answer. Hope guys you have answered these 10 questions and you scored 10 points. Let's go to the next question. The next question is, what are the layers of the heart? Okay, so the heart wall is made up of, or we can say it is composed of 3 layers. Okay, 3 layers. What are they? One is epicardium, that is the outer layer. The epicardium, that is outer layer, and in the middle you have the myocardium, and then the inner layer is called the endocardium. So epicardium, the outer layer, myocardium, the middle layer, and endocardium, the inner layer. So these are the 3 layers of the heart wall. Okay, so heart wall, it is composed of these 3 layers. Okay, so hope you got the answer. The next question is, what is heart muscle called? What is heart muscle called? Okay, see, as we know that in our body there are different kinds of muscles, yeah, but the 3 major muscle types are the skeletal muscle, the smooth muscle, and guess guys, it is the cardiac muscle, okay, which is present only in the heart. Myocardium, refers to as myocardium. Okay, so the answer is cardiac muscle. The heart is made up of cardiac muscle. Fine. Okay, then the next question is, what is the fluid that reduces friction? Or in other way it can be asked like, what is the fluid that surrounds the heart? Okay, so as we discussed before, that heart is surrounded by a thin sac called the pericardium. Okay, it is made up of different layers, and in between these layers, in the pericardial sac, there is a fluid called pericardial fluid. Okay, what is that fluid called? Pericardial fluid. Fine. And this fluid protects the heart. Okay, so it reduces friction within the pericardium. It lubricates the epicardial surfaces. Okay, in a normal adult, if you see, around 50 ml of pericardial fluid is present around the heart. Okay, but sometimes because of some reason, this pericardial fluid increases. It gets excessively collected in the heart. Then this condition is called pericardial effusion. Okay, and this puts pressure on the heart. The heart cannot contract properly. Then that time what they do? They do a procedure called pericardiocentesis. So first is they confirm it with the 2D echo. Okay, then after that they will do a procedure called pericardiocentesis, which relieves the pressure from the heart. Okay, that removes the excess pericardial fluid. Okay, and relieves the pressure on the heart. Fine. So hope guys you are answering all the questions correctly. Then let's see what is the next question. The next question is, which is the largest chamber of the heart? So as we discussed before, there are 4 chambers in the heart, right guys? Okay, the right atrium, the left atrium, the right ventricle, and the left ventricle. Among these 4 chambers, which is the largest chamber? The largest and the strongest chamber of the human heart is the left ventricle. Okay, it is the left ventricle. This is the strongest and the largest chamber of the human heart, because it is from this chamber the blood has to go to different parts of the body. Okay, it has got a major work to do. So the important side of the heart is the left side. Okay guys, okay, fine. So hope you got the right answer. Then the next question is, what is the primary organ of the circulatory system? Very easy guys. The primary organ of the circulatory system is the heart. Okay, the circulatory system, which is made up of the heart, the blood vessels, okay, which contains the arteries and the veins and the capillaries. Okay, but the primary organ is the heart. Okay, fine. Then the next question is, what is the main function of the heart? There are many functions of the heart, but in short, if somebody asks you what is the main function of the heart, how will you answer it? Okay, heart is, it acts like a pump, right, in a human body. Yes, it works like a pump. It's a pumping machine. And what it pumps? It pumps the river of life, that is the blood. Okay, so heart continuously pumps the oxygenated and the nutrient rich blood throughout the body. Okay, to sustain life. That is the main function of the heart. Heart, which works like a pumping machine in the human body, and what it pumps? It pumps the river of life, that is blood. So heart continuously pumps oxygen and nutrient rich blood throughout the body to sustain life. Okay guys, okay, the next question is, which side of the heart has deoxygenated blood? What is deoxygenated blood guys? Deoxygenated blood is nothing but the carbon dioxide rich blood, or in other words we can say it is oxygen poor blood. Okay, more of carbon dioxide and less of oxygen. So the answer is the right side of the heart. Okay, as you can see here, which is indicated in the diagrams with the blue color. Okay, so the right side of the heart, it contains deoxygenated blood, okay, which is considered to be impure blood, which is collected from the veins and then it is pumped to the lungs where the exchange of gases takes place, and then from the lungs the blood is returned to the left side of the heart. Okay, the next question is, which side of the heart has oxygenated blood? Simple. Okay, the left side of the heart has deoxygenated blood, and the right side of the heart has deoxygenated blood, and the left side of the heart has oxygenated blood. Oxygenated blood is nothing but the blood which is rich in oxygen, which is pure, okay, which is coming from the lungs. Okay, so the first thing what happens is, I think you know this guys, right? We are studying this in school. Okay, the deoxygenated blood from different parts of the body, it is collected by the veins and it is collected in the right side of the heart, and from here it gets to the lungs where the exchange of gases takes place. Carbon dioxide is deloaded and oxygen is loaded again into the blood. Okay, and then from there the oxygenated blood comes to the left side of the heart. Okay, and from here through the left ventricle it is getting supplied to different parts of the body. Okay, so the answer is left side of the heart, which contains oxygenated blood, and right side of the heart contains deoxygenated blood, which is carbon dioxide rich blood. Okay, hope guys you have answered you have answered it correctly. Okay, then the next question is, what separates the right atrium and the left atrium? Okay, so as we discussed here, see, this is right atrium and this is left atrium. What is separating them? It is separated by the septum. Actually, all the four chambers, it is separated by a wall called septum. By a wall called septum. Okay, the right atrium and the left atrium, they are separated by a septum called the atrial septum. Okay, atrial septum. And the next question, what separates the right ventricle and the left ventricle? The answer is, come on, it's easy guys. It is the left ventricular septum. Okay, so atrial septum, it separates the right atrium and the left atrium, and ventricular septum, it separates the left ventricle and the right ventricle. Okay, otherwise the blood gets mixed, right guys? There is no point in having chambers then. Fine. Okay, then the next question is, what is the normal heartbeat? Simple. What is the normal heartbeat? The normal adult resting human heartbeat is 60 to 100 beats per minute. Okay, so the normal resting heart rate is 60 to 100 beats per minute. Okay, let's go to the 22nd question. The question is, how many times a heart beats in a day? How many times a heart beats in a day? If it is beating about 60 to 100 times in 1 minute, how many times it beats in a day? Each day on an average the heart beats about 1 lakh times and it pumps around 7,500 liters of blood. Okay, so the answer is, each day on an average the heart beats about 1 lakh times and it pumps around 7,500 liters of blood. Oh guys, you all are answering and enjoying the quiz. Okay, the next question is very interesting again. It is related to the types of heart valves. Not wall guys, it is valves. Okay, so what are the types of heart valves? Valves are nothing but they are like doors. Okay, doors that controls, or that we can say that regulate the blood flow through your heart. Okay, so heart valves are nothing but the doors that regulates the blood flow through your heart. So there are 4 different types of heart valves. Okay, the first one is the tricuspid valve. Okay, which is between the right atrium and the right ventricle. Here, this one, as you can see, this is right atrium, this is right ventricle, and between them you have the tricuspid valve, which controls the flow of blood from the right atrium to the right ventricle. Then next is the pulmonary valve. Okay, which is between the right ventricle and the pulmonary arteries. Okay, pulmonary valve, which is between the right ventricle and the pulmonary arteries. Fine. Then the next valve is mitral valve, between the left atrium and the left ventricle. Here, mitral valve. This is left atrium, this is left ventricle, and in between them you have the mitral valve, which controls the flow of blood from the right atrium to the right ventricle. They prevent the backflow of blood, guys. Okay, it is only one-way street. They prevent the backflow of blood. Then the next valve is aortic valve, which is present between the left ventricle and into the aorta. This one, where it is, yeah, aortic valve. Okay, between the left ventricle and into the aorta. Fine. So these are the 4 types of heart valves which regulates the flow of blood through our heart. Okay. Hope you got the answer, guys. Then the next question is, what is the primary pacemaker of the heart? Come on, guys, it is displayed on the screen. What is the primary pacemaker of the heart? The primary pacemaker of the heart is the SA node, which stands for sinoatrial node. Okay, which this one, sinoatrial node, which generates the electrical impulses that controls the heart rhythm and the rate. Yes, sinoatrial node, which is also known as the primary pacemaker of the heart. Okay. The next question is, what is SA node also called? This one. Okay, the SA node, it is also known as, from where the impulses are generated, the electrical, the conduction system of the heart. If you are aware of, guys, then you might have come to these 5 main elements of the conduction system, right? Okay, and SA node is the primary one. So the SA node is also known as heart of heart. Okay, this is our heart, and the SA node is the heart of the heart. Okay, because it is the place from where the electrical impulses are generated, which causes contraction of the heart. Okay, the 5 main elements of the conduction system of the heart, right? SA node, then the AV node, then you have the bundle of His, okay, which is divided into right bundle branch and the left bundle branch, and then it goes to the Purkinje fibers, yes, and then to the ventricles. Okay, so the SA node, it is also known as the heart of heart. Okay. Then the next question is, what is the secondary pacemaker of the heart? The secondary pacemaker of the heart is AV node, that is atrioventricular node, AV node. Okay, from SA node the impulses comes to the AV node. Okay, that is the secondary pacemaker of the heart. If there is a problem with the SA node, the impulses are generated by the AV node. The AV node takes up the responsibility. Okay, so they manage it. Then the next question is, what are some common types of heart diseases? Okay, there are many, right? But can you list some of the common heart diseases? One is CAD, coronary artery disease. Yes, heart arrhythmias, different kinds of arrhythmias. Heart failure, yeah. Heart valve disease, okay, different kinds of diseases related to the heart valve. Pericardial diseases and congenital heart diseases. These are the main categories of the most common heart diseases. Okay. Then the next question is, what are the risk factors of heart diseases? Or in other words, what increases our risk of heart diseases? Okay. The first one is high blood pressure. Okay. High blood pressure, increased blood pressure. And next is high blood cholesterol. Okay. High blood cholesterol, if the people are having high blood cholesterol. Then diabetes. Okay, diabetes is also a risk factor. Then obesity. Okay, high cholesterol, diabetes, obesity. Okay, then smoking. Okay, and then less sedentary lifestyle. Okay, less physical activity or physical inactivity, and male gender, because it is more common in males than in females. Then the family history, okay, genetics, if we have a family history of heart diseases. Then older age, as the age increases, the risk of having heart disease also increases. And the main killer, stress, okay, which is leading cause again. Stress also increases the risk of heart diseases. So these are the risk factors that we must be aware of and modify our lifestyle accordingly, so that we can prevent, because prevention is better than cure, right? So we have to concentrate on prevention. So if we know these risk factors, we can take care. Okay. Then the next question is, what helps to prevent heart diseases? Okay, now we know the risk factors. Yes, the high blood pressure, high cholesterol, diabetes, obesity, smoking, physical inactivity, male gender, family history, older age, stress, etc., etc. Now we know the risk factors. Then how to prevent heart diseases? Simple. We have to take care of the risk factors. Yes, that is, we have to control the blood pressure. Okay, regular checkups and be on proper medication. Control the cholesterol levels. Okay, maintain healthy weight. Okay, then eat healthy diet, do regular exercises, limit alcohol, limit smoking, manage stress and quality sleep. Okay, so these are some of the ways in which we can prevent heart diseases. Okay, see, some risk factors are non-modifiable. We have no control over it, like for example age and gender and family history. This we cannot do anything. Yeah, we are already predisposed to, but there are some modifiable risk factors like our diet, yeah, like our activity, like smoking, alcohol, all this we can manage. So we have to take care of these things so that we can prevent heart diseases. Then the next question is, what are the silent signs of the heart attack? Okay, so what are the, why we should know this? We should know this so that we can seek help. Yes, we should not ignore them. Okay, why we are discussing this? Because if we are facing these symptoms or if we are noticing this, immediately we have to seek medical help. Okay, and prevent complication. That is the main goal of the World Heart Day, right? To create an awareness to related to the signs and symptoms, prevention of the heart diseases, to prevent the complications and to reduce the mortality and morbidity rate. Okay, so what are the silent signs of the heart attack? There are many, but okay, you remember these three things. One is chest pain. Okay, sudden and intense chest pain. It can be mild or it can be severe. Okay, sudden and intense chest pain in the center of the chest. Okay, we feel it may be like a pressure, it may be squeezing, or it may be fullness, and it may radiate to one or both arms, back, neck, jaw, or the stomach. Okay, so this is one classic sign, chest pain. And then the next one is shortness of breath. Okay, that is breathing difficulty they will have. Okay, and next is dizziness, okay, or lightheadedness. And then next they will have nausea or vomiting. Okay, and cold sweats. Okay, so these are the warning signs, or we can say the silent signs of the heart attack. And if we notice this any time of the day, anywhere, whatever you're doing, please stop that and immediately seek medical help to prevent complications and to get treatment in time. Okay, so don't ignore them, be aware of them, seek help, be cautious and seek emergency treatment. Okay, so these are the warning signs. Then what? We have finished 30 questions already. Okay, so guys, who got the highest score? Okay, hope you answered all the 30 questions correctly and got the highest score. Okay, so these are the things that we should know about our heart so that we can take care of it in a better way. Okay, and create this awareness globally so that we can prevent heart diseases and manage cardiovascular diseases. Fine, so take care of your heart, guys. It is the most amazing organ in the human body. Okay, and it is central to life and key to healthy life. Okay, so if you like the video, thanks for watching. And if you like the video and found it helpful, please do like, share and subscribe my channel, Nurses the Heart of Healthcare. Thank you so much for watching. Stay connected with Nurses the Heart of Healthcare. Knowledge related to medicine is a blessing. So please don't keep it with you. Share it, enhance it, and knowledge is meant for enlightening yourself and others. Okay guys, so hope it was helpful. Thank you so much for watching. Stay connected.